Now, you've probably been put into the VACOped already, but at points throughout the rehab process, you are going to need to take it on and off. Certainly in that initial phase, it's so important, even when you're asleep, to keep your foot in that plantar flex position. Now, to put the boot on, we're just going to go through it nice and slowly. The first thing to do is to make sure that the valve is open. So you just pull that open and then you can just squeeze it and pull it towards yourself. So that bit of plastic comes to the end. Okay. Next thing you're going to do is to open the straps that may already be open, obviously. And you can see what we've done here is we've got the foot in that plantar flexed position. We don't want that heel going down to the floor in those early stages because we don't want to lengthen that tendon. And that is what all of this is focused towards doing, is to allow that to heal well. So if we take the straps off, then we can pull out the superior skeleton. And obviously we can get rid of the inferior skeleton. And then what we're left with is this rather comfortable looking blanket for your feet. Make sure it's nice and smooth everywhere. Now, then what we're going to do is we're going to get that. Now, we don't want to lose this position. So actually all you need to do is keep that position and straighten your knee, and then just ask the person to just push back into the back of the fabric there. But you can see we've still got that nice position, so we've still got the position that we need for the healing. You could just use a book or a yoga block or something just to make sure that that heel is higher than the forefoot. So we push that right the way back in. Now we're going to start bringing this round, so we'll start at the bottom, make it nice and comfy. Doesn't need to be too tight at this point. And then you're just going to put the top round as well, keeping that position. And then at this point, ask your patient just to get the heel, keeping this block here, but get the heel to the back of the fabric, and that's ready to go. The next thing you're going to do is you're going to use the inferior skeleton. So again, if you just ask your patient just to straighten the knee, and then obviously make sure you've got all of the straps out the way, and then your patient can just push their heel into the back of the shoe, just like that, and you can give them a little bit of help. And just with your thumb and your index finger, you can just push them all the way back. Now at this point, we can take out this block because obviously we've got the heel of the heel of the VACOped, which is putting it in a good position. So we just need to slide this back, ask your patient to get the heel right as far back. I can push it in and just bring the back of the skeleton forward as well. So if we bend the knee a bit more, that's going to be a nice position. The next thing to do is to get the superior skeleton on. So you can see you've got these flaps either side. So you're just going to put that just underneath that bit of plastic, get the straps out the way, and it's the same on the other side. Now, the first strap to get on is going to be this strap across the middle. So it's good to get that in straight away so you get the heel all the way back. And you can always tighten it a bit more after. Obviously you don't want to stop their blood supply to their toes, but it does need to be quite firm because it is giving you the structure to make sure that you don't go out of that position that we want. And then obviously you can pull that strap and then we can also do this. Now at the top, the skeleton actually goes over the top, so it overlaps. So just make sure they're nice and even there. So remember, at the bottom it goes on the inside, and at the top it goes over the top. And then if we just put these straps on, you can start off with them a little bit looser, so you don't shock your person too much. But then you can always go around and just make sure you tighten up. Do make sure the valve is free and not overlapped by the straps. And these are really comfortable. So that should be a nice snug fit for your patient. So now we've got the boot on, you probably feel like you're pretty much there, and you are, but actually we see lots of patients that forget to do this last bit, and particularly in the early phases it's so important because we need to pump up the VACOped to ensure that you maintain the correct position for your ankle. So with the valve, you're just going to push it backwards, you'll get a pump, push the pump on, and then pump up. At that point, bring the valve off and pop the lid back on, and then you're good to go.